dental crowns are an everyday treatment that many will require at some time during their lifetime. Crowns can be used to improve the size, shape, and functionality of a decayed or damaged tooth. They are a crucial component of maintaining good dental health. Some are concerned about the price that dental crowns can cost. Cost factors of dental crowns. The price of dental crowns varies in accordance with a number of variables. A few of the major factors that affect the cost of dental crowns comprise: 1. Material. Dental crowns can be made from a variety of materials, including metal, porcelain fused to metal, all porcelain, and zirconia. The type of material used for the crown could dramatically impact the price of the crown by a large margin, with the metal crowns are the most affordable, while all porcelain crowns are most costly. 2. Where you live. The price of dental services can fluctuate dramatically based on the geographical location of the dental practice. In urban areas, dental services tend to cost more in comparison to those located in rural areas because of the price of living. 3. Experience of dentist. The knowledge and experience of the dentist who is performing the procedure could also influence the price on dental crowns. Dentists that have practiced for several years and who have the highest level of experience could charge a higher price for their service. 4. Insurance coverage. Certain dental insurance plans can pay a part of the costs associated with dental crowns. These will reduce the out-of-pocket expense for patients. You should check with your insurance company to find out what's covered by your plan. Average cost of dental crowns. In the average, the price of a crown for dental use can be anywhere from $500 to $3,000 for each tooth. The price can be varying based on the elements mentioned above and also the degree of difficulty and the additional treatment necessary. The metal crown is typically most affordable, at an average of between $500 and $1,500 per tooth. Porcelain fused to metal crowns are slightly more expensive, with an average cost of $800 to $2,000 per tooth. Crowns that are all made of porcelain are considered to be the most costly option that cost an average of between $800 to $3,000 per tooth. Even though they are expensive than other crowns, they have a natural design and long-lasting durability. Additional costs to consider. Apart from the expense of the crown, it is possible to incur additional expenses that patients need to be informed of. A few of the most frequent additional expenses include decayed. The cost for a crown is: 1. Consultation fees. Certain dentists will offer a consultation charge to talk about treatment options and to develop the treatment program. 2. Dental preparation. If your tooth requires further procedure or preparation before a crown is able to be put in for placement, like dental fillings or a root canal of the tooth, it could contribute to the total cost. 3. Temporary crown. In a few situations, the temporary crown can be made during the time that the permanent crowns are being created. The temporary crown can result in an additional expense. 4. Checkups. Patients may have to arrange follow-up visits to examine the functionality and fit of the crown. These visits might incur additional expenses. The overall cost for dental crowns is contingent upon a myriad of variables. Patients are advised to explore all possible treatment options as well as costs with their dentist prior to undertaking any treatment. Dental crowns are a vital component of maintaining good oral health. In fact, investing in them could help improve the functionality and appearance of teeth that have been damaged.